Please give me your date of birth, sir.
4/10/72.
So how old are you, sir, currently?
I am 39 years old.
Single or married?
I am single.
And who drove you here today?
My mother.
Do you drive at all?
When I'm not varying myself in pain medication, I try and drive, but when I'm taking the pain pills, I shouldn't be driving.
So
I didn't drive.
if you didn't take the meds, what kind of distance can you drive?
I drive, just locally a few miles.
Okay.
But again, I'm on pain medication constantly, and it's
Okay, no problem. Please tell me very briefly, when did you get injured?
May 9th. I was in a self-defense training class.
Which year, sir?
2011.
Oh, last year.
Yes.
Where?
It was at Curtin Auditorium, which is part of the Gallerias on South Salina Street, I believe.
Okay.
So everything was fine. I went to the self-defense class.
So it was a self-defense class?
Mandatory.
Okay.
The instructor karate chopped me to the left side of my neck. And ever since then, I've had constant neck pain.
Just let's go slow.
Okay. Sorry.
So instructor karate chopped you on the left side, you say?
Right here.
Okay. Left side. And since then you have constant pain?
I have constant neck pain in my neck.
Neck pain.
And it's...
Anything else, sir?
I'm just in constant pain. And I'm trying to get tests done to diagnose it.
So you have constant neck pain, or what else do you have?
I just have neck pain. I'm in constant
Neck.
physical neck pain.
Which side, please?
It radiates down the shoulders.
Oh, okay. Radiates both sides of the shoulder?
Both
or
sides,
radiates
more on the left.
both sides of the shoulder. Okay, both sides of the shoulder.
So I started...
And how would you describe the pain? Sharp, dull?
burning.
Burning.
Burning pain.
Burning pain. Okay. Just burning.
It's burning pain.
It's not sharp or it's not anything else. Just burns.
It's a constant burning pain.
Constant
burning.
Constant burning.
Stinging, burning,
And it's present all the time,
all the time.
even when you sleep?
I can't sleep. And I'm...
So tell me, they must have done what we call MRIs or CT scans or whatever.
I had an MRI.
And what was the diagnosis on the MRI?
Inconclusive.
So they could not find a ruptured disc or a herniated disc.
I read the reports, but one report says disc protrusion.
But you say just now inconclusive.
No one...
So they're not sure.
They're not sure.
Okay, that's
I called another doctor today in Syracuse. He's a neurosurgeon. His name's Dr. Chin. I said, what do you think? Can I come in and see you? And he said, well, your last MRI was done over 6 months ago. You should have a more recent MRI. So I called Anthony Past. I said, can I have a more recent MRI? He said, well, that depends. You have to go. The doctor has to write a prescription. We have to find somebody that participates. And I don't even know if that's going to happen or if that, so. Okay. But I've had CT exams, MRI. They say things, but
So everything so far has been inconclusive.
I would say inconclusive.
Okay, that's good.
And
what are the current
They say some things. They say something C3-4, another thing says C5, C6. One says disc protrusion, one says nerve
What are the current
root blunting. I don't know what that means.
Okay. What are the present medications, please?
I take Vicodin,
Vicodin.
10/325. I take it 8 times a day. It's not enough. 10/325 is what it says.
325. And you take how many? 10 a day?
I take 8 a day.
8 a day.
And I took my last, I have four more to take today.
And what else do you take, sir?
Ambien. They give me Ambien, so I swallow that every day.
So that's 10 milligrams at bedtime.
Every time. And then I also take Lyrica 3 times a day, 150 milligrams.
150 3 times?
Yes.
Okay, sir. Anything else?
That's it for the pain.
That's it. Okay. And who prescribes or where do you go for?
I go to the pain clinic, New York Spine and Wellness.
Pain clinic. And which nurse practitioner is treating you?
Dr. Tellerico.
How often do you see him personally? Probably you
I
see
think
him.
my last appointment, I think it was somewhere in January, or maybe maybe a couple months ago.
So your
But
visits
I have an appointment tomorrow.
Your visits are every 2 months, approximately.
Approximately, approximately, maybe
All right.
2 to 3.
Where else do you go for treatment?
I saw Dr. Zeidman in Rochester.
And are you still under his care?
Yes, I saw him, and
When did you see him?
well, I saw his physician assistant back January. They ordered a CT myelogram, and I had that done recently.
Okay.
And that's the one that says nerve root and blunting.
Just
But again, I haven't talked to the doctor specifically, so
Okay,
I actually follow up with
so
him March 8th.
March 8th, that's
But,
next appointment? Oh, okay, good. So-
I just want someone to fix my neck and get it over with. And I'm sorry that
That's okay. I'm here only for the psychiatric aspect of your problem, so I'm not going to do an exam or anything else.
So you're not here for my pain?
I'm here because...
I don't even know why I'm here.
Okay.
I'll be honest. I don't know why.
Okay.
I mean, I have a neck injury. I've been in pain for 9 months. Why am I here?
I am a psychiatrist, and they have asked me to evaluate you for depression or something else.
Okay.
That's
All right.
That's I think what they are saying.
Whatever.
So let me ask you, sir, how long have you had psychiatric problems because of the injury?
I've never had psychiatric
You
problems.
never had psychiatric.
Worked until I got hit in the side of the neck and this injury occurred. Everything was fine.
Okay, now what I'm asking is, after the injury, approximately when did you start having psychiatric issues?
I don't have psychiatric issues.
Oh, you don't?
I don't think I do.
Okay.
I'm in constant neck pain.
Because it looks like some doctor, when you went for IME, recommended psychiatric exam.
Yeah, Dr. Stewart he put in his notes, I know he wrote it, I read it, depression. I don't know. I don't know how he came to that deduction.
Okay. So you know that. So you read that.
I just know I'm in constant physical pain.
So we are not talking really about psychiatric issues then.
I don't know. I just can tell you that I break out in tears for no reason. I don't know why. At this point, I had my will in place, and I'm ready to go. I'm in physical. I just need a doctor to fix my neck. And if if the doctor orders an MRI and I have to wait 6 months for approval, which seems, the CT was ordered in August of 2011. I had it done in January. I know COM takes a long time, but I'm looking for answers. I'm in constant pain. I hate swallowing these pills. They're probably going to bump me up to something stronger because obviously I've been taking the pain medication for so long. It's no longer touching the pain. So I go to the pain clinic tomorrow. They're going to do something else.
All right.
I don't know why I'm here. I don't know if I'm depressed. I don't really. All I want is whatever tests they can do to help diagnose. Because as I said, I've worked my whole life. I don't know. I don't know why I'm here.
Okay.
I'm sorry.
That's fine. No, don't worry.
Whatever.
Please tell me, sir, have you ever had psychiatric treatment
No,
before this
never.
accident?
Never.
Never. Did you ever receive psychiatric medications anytime?
No.
Prozac, Zoloft, Paxil?
No.
Did you ever receive counseling at any time in your life?
No. As I said,
No problem. Don't worry. Have you ever abused alcohol?
No, I don't drink. I don't smoke.
Have you ever abused drugs
No.
in your life? Are you taking more of the pain pills than you should, or do you stick to the dosage?
Well, I right to the borderline. I mean, today's my last day, and then tomorrow, they would give me a refill.
So in other words, you haven't taken more than you should, correct? Because you say your prescription is due tomorrow.
I'm taking what they're prescribing me.
So in other words, you are not taking more.
No.
Okay.
But again, I can't. The no longer touches the pain. The pain, either I keep taking the pain pills, so now it doesn't work. So I don't know what's going to happen, because it's been, as I said, 9 months. And, the last exam I actually just paid for myself. I wrote a check for $1,100 out of my own checking, because I just said I need answers. So I'm very frustrated, but I'm also a realist. If I can't continue to live like this.
Do you have any history of physical trauma as a child?
No.
How about any sexual traumas as a child?
No.
Tell me, please, what kind of work were you doing before this injury?
Worked for a caseworker in Onondaga County.
Oh, you're working for DSS?
Correct.
Oh. Onondaga County DSS. And what kind of work?
Child Protective Services.
Oh, CPS.
Yes.
Okay, all right. So you would visit the families and investigate?
Go to the schools, interview the kids at schools.
Okay. How many years were you working, sir?
I worked 6 months until I got hurt and the guy karate chopped me in the neck.
So since the injury, have you returned to work?
No.
So since May 2011?
The last day I worked was May 16th, 2011. Got injured the week before.
Oh, you did go to work for 1 week?
Yep, I got hit in the neck and it hurt, but I said, well, I thought it would go away. I thought it would get better. I thought it must be a torn muscle or something. I don't know. But I waited, gave it the weekend, came into work Monday and said, something's not right. That's when I reported it. And since then, I just keep, I'm looking for answers. I don't know what's wrong. But I'm just trying to get to, that's my goal.
Okay.
And
so please tell me, before the CPS, what did you do?
Before that, I worked in different call centers.
Call centers. Anything else you did?
And before that, I worked for an engineering firm, because that's what my degree was in from college.
How many years for the engineering firm?
Oh, God, 4.
4 years? And call centers, how many years?
4 years.
Okay. Anything else you've done?
That's basically it.
Okay. Any military service?
No.
Have you done any volunteer activities or any kind of work somewhere else since the injury?
No.
Tell me about Where were you born? Your education, please.
I was born in Brooklyn, New York.
Oh, born in Brooklyn. And did you go to school there?
No, I went to school up here in Syracuse.
So at what age did your parents move here?
I was a baby.
Baby.
I don't know, 4 or 5.
Okay. Where did you graduate from? Which high school?
West Genesee.
And how about college?
ESF.
Which one?
ESF, Environmental Science and Forestry.
That's the part of Syracuse University, right?
Correct.
SU. Okay, so your bachelor's degree
Correct.
in what do you call that?
Environmental Studies.
Environmental studies. Any other bachelor's? Or that's all?
That's it.
Any master's
No
credits?
masters?
No credits?
No, just a BS.
Yes, okay. Your family, parents alive?
Parents are alive.
How old is dad?
65.
Where does he live? Here.
Yeah, here in Syracuse.
And mom, how old is she?
63.
And any brothers, sir?
I have 1 brother,
And sisters?
no sisters.
And how is your relationship with family members?
Fine.
Any family members suffer from depression, anxiety, schizophrenia,
No.
bipolar illness?
No,
Any kind of psychiatric issues?
none.
None. Any family members abuse drugs, alcohol?
No,
Any family members attempt suicide?
no.
Any family members have history of back injury or back operations or neck operations?
My dad is
Ruptured disc herniated
back and neck problems, but I guess they say it's old age, but
Old age. Oh.
he is back and neck, you know.
Did you have any other work-related injuries?
No.
This is the first and the only one?
The only other work-related injury I ever had when I was probably 18 years old, and I was working at Walmart, and I dislocated one of my thumbs. I think it was my left, but I don't remember. It was a long time ago,
Okay.
and they just reset it, put it in a little cast, and
Were
so
you-
that was the only
Were
other.
you out of work for a long time?
No, they put me right back to work like the next day.
Any,
They made me the greeter since I couldn't
any,
do the physical work.
any motor
But
vehicle?
that was a long time ago.
Any motor vehicle accidents?
None.
All right. How is your physical health? Any problems besides this neck, of course? Besides the neck issues?
No.
Diabetes,
No.
heart problem?
No. I mean, the only problem I have is my neck.
So
But
otherwise you're in good
well,
health.
I mean, swallowing all the pain medication they keep throwing at me, it's very hard to go to the bathroom. So they give you stool softeners. I mean, but
Sure. Side
I mean, you know, what can I say? You know, there are side effects to the medications.
Any surgeries?
Yeah, I mean, I've had umbilical hernia surgery.
Uh-huh.
Had a prior back surgery.
Oh, you had a back surgery?
Yep. Yeah, 2003, but, you know,
Back surgery, 2003.
Yep.
Where?
L45,
Oh, okay.
Yep. took a disc out,
Mhm.
and day after the surgery, I felt better. And everything was, you know, they fixed it.
That was done by Dr. Zellman?
Yeah, he fixed it, he diagnosed it, and so, you know,
So since then, no back problem.
no bad problems, but that's why I wanted I want to know what he thinks is wrong with my neck. Since he did my back, and I figured I'd trust him and see what he says, and I'm trying to get answers here in Syracuse, but I mean that's my priority. But if I have to wait another 9 months for another exam, for another test, I can't, I'm not, I have private insurance I pay for, and they won't cover it because it's workers' comp. So, it's very frustrating. So, I'm just, whatever. I got to do what I need to do. I know at this point the only way something's going to get done is if I do it. So,
So your main issue really at this point is a constant burning neck pain. Correct?
Yes. My neck pain and constant physical pain, which is what I keep telling all the doctors. And I don't even know why I'm here. Well, I do and I don't. If I've been in pain for 9 months and, you're not getting better, could you get depressed? I don't know. Maybe. But as far as what's wrong with me, I know physically it feels like my neck is going to explode. It's constant pain. And that's what's wrong with me. If I can find a doctor that can, whatever they can do, operate, do something for my neck, figure out what it is, that's my priority. At this point, I see my doctor, he orders a CT exam. I see an IME doctor, he says I'm depressed. You know what? Whatever. I'm very frustrated with the way things have gone so far. Am I depressed? I have no idea. I just know that if I can't move on with my life, I have to do something.
So what do you mean by that?
Just means that I have to make plans for the future.
So what exactly I don't understand.
I just have to have things in place. That's all I'm saying.
Are you thinking of hurting yourself?
I prefer not to answer that question.
Have you thought about how you would hurt yourself?
I prefer not to answer that.
How often do you break down and start crying?
Usually when the pain gets to the point where it's very difficult to manage.
So, does it happen every day, once in a while?
It doesn't happen every day.
Once a week?
I would say once a week is probably fair.
How many hours of sleep do you get?
Sometimes I get a couple hours of sleep, sometimes none. Sometimes from exhaustion I'll sleep in the chair. I put the ice on it, take pain medication. I take the Ambien.
How is your energy level?
Exhausting. It's difficult to take a shower. It's, just trying to, get somewhere.
How is your appetite?
I've lost weight. And
How much have you lost?
Probably 25 pounds.
Have a sexual desire?
There is none.
Do you see things, hear things which are not real?
No, I
Does it-
don't see things. I don't hear things. I know what reality is.
I want you to remember 3 objects, and I'll ask you a little later to repeat for me. Bell, candle, telephone. Bell, candle, telephone.
Okay.
Okay? Can you subtract 7 from 100 and keep on taking away 7 from each number? 100 take away 7 is 93. Now you continue. Take your time, don't worry.
Oh God. Or 85 or 86. 86. 79. 72. 65. 58. 51.
One. What day is today? No,
Monday.
Monday. Okay. What's the name of this road where this office is located?
Milton.
How far is it from your house, from your place? Approximately.
It's about 10, 12 minutes away.
Give me your phone number, please.
256-3175.
Have you ever been married?
No.
Do you have any children?
No.
Are you currently in a relationship with anyone?
No.
I presume you are heterosexual, right?
Correct.
Okay. What were you doing last Monday at this time?
Oh. Saw another psychiatrist.
You did?
Yes.
And why is that?
Because of the last IME. So they sent me to healthcare psychological services.
Oh, so you are under the care of a psychologist?
No. Pain clinic wanted me to go see.
So you are seeing a psychologist there.
Well, I went one time last Monday. For just one appointment.
What's the name of this?
Some girl over there, Dr.
Oswald?
Maybe. Say another name?
Oswald?
Might have been her. I don't remember.
Did she do any testing or just sitting down?
She sat down, asked me questions. I told her the same thing I'm telling you. I got neck pain.
And
So-
what did she recommend at the end of the session?
She made another appointment in March, and that's it.
Oh, so she wants you to go back.
But I don't have permission to go back yet. That's up to.
Okay, let me ask
Just-
you, when you went there and you talked to the psychologist, did you feel talking to her helped you?
No.
No?
No. I'm in physical pain. How is that helping me?
So you feel talking to her is not going to make any difference?
I don't think so. I don't know. Maybe it will. You know, I can't make that decision. I went once.
But your problem is physical.
Yeah, something's wrong with my neck, and I'm in constant pain. It's just, the longer it goes on, the less hope there is.
Tell me about your daily routine, daily activities. Do you take showers every day?
No.
How often, sir?
Usually I maybe third day.
How often do you change your clothes, sir?
Probably the same.
Same.
It's just hard.
So do you live in a house, apartment? What kind of residence, dwelling is it?
It's a house.
House. And is it your house?
No, it's my parents.
So do you live with your parents?
Yes.
Oh, okay. Mom and dad?
Yes.
Oh, okay. Who else is in the house?
Just them, me.
Are they retired or do they work?
Dad's retired. Mother works.
Does she work for the county by any chance?
No.
So what do you do around the house to help your parents? Cooking.
I
Do you
don't-
help with
I don't
cooking?
do anything.
You don't help with cooking?
I don't cook.
Cleaning? Vacuuming?
I can't do anything other than take pain pills and feel like a zombie.
So do you do laundry or does your mom or dad?
Right now, they're helping me with everything.
Everything? How
I
about
mean,
grocery
they
shopping,
do shopping, laundry, driving.
driving? Do you socialize at all? Do you go out?
No,
Do you mix with your friends, buddies?
I don't do anything anymore.
You stay home all the time?
Yes,
How do you spend your time from morning till night?
TV.
TV?
I mean, walk down to the mailbox. I mean,
Do you take walks every day? Do you go
No.
to the gym?
no. I mean, I keep, on the phone with insurance companies. That's, a lot. I mean, spend a lot of time doing that. Trying to get an MRI, trying to get a CT, trying to get whatever it is, just, that's a battle. So you just, you're constantly fighting to try and get, whatever.
Do you go to church?
No,
Did you go to church before the
No.
accident? Do you keep in touch with fellow workers at the DSS?
no.
So tell me, Peter, before this accident, if someone asked you, Peter, describe yourself, what kind of person you are, what kind of personality, what would you say before the accident?
Organized.
Organized. What else, sir? Were you very meticulous? Were you very fussy?
I was meticulous, compassionate.
Passionate, kind?
You know, I had a kid who mother was called in for child abuse, and I remember that the reason she was called in is the school wanted the kid in occupational therapy, required a doctor's signature. Went to the mom's house, doctor's office wouldn't sign it because she had outstanding bills. So the kid wasn't getting therapy. So I personally called the doctor, said, "Can you sign off on this?" He said yes. Doctor signed off on it. I got the kid in occupational therapy. So I was helping people, making a difference. So, I really liked my job.
Tell me, please, did you ever engage in any rituals like hand washing, checking the light, checking the doors, what we call compulsions, OCD kind of things?
No,
There were no compulsive acts.
no,
How about, did you ever have what we call obsessive thinking about the same thing, ruminating again and again and again in your mind?
no.
Did you ever suffer from anxiety where you became what I call an undue worrier?
No,
Like little things would bother you,
no,
you would visit doctors, so you would try to
No.
get things straightened
No.
out.
no,
So you're never a worrier.
no.
Did you ever suffer from anxiety or panic attacks? Your heart would beat fast, you couldn't breathe,
No,
palpitations.
no.
When you say you're organized and meticulous, to a fault or just normal? Like, did you get to work before your time or would you be late for work?
I would always be there 15 minutes
15 minutes
early.
early? Okay. And if you had an appointment, you would always be there 10 minutes before the appointment?
Yes. Like today.
Like
Except I ended up going upstairs instead of downstairs. I
Yeah.
made that mistake, but
You would start getting nervous before you left home, that hope you are not going to be late, even though
I'm not nervous. I'm just in a lot of physical pain. And it's going to stay like this until I find out what's wrong.
Tell me again, briefly, tell me about the injury. This person who karate chopped you, was he a supervisor or who was he?
He's a county employee.
County employee.
They said, okay, it's self-defense pepper spray training,
So
mandatory.
it was one, so he was just an employee like you?
I went over there, left my desk with everyone else. We watched a video, they gave you some pepper spray, and then he was going, we had partners.
So he was your partner?
No, he wasn't my partner. My partner was Angela Myers, and he's like, if you're ever being choked, this is something you do. So he came around, and Angela and I were doing it, and he took Angela's place because Angela said, was I doing this right? He came over, so I went, he said, choke me. I put my hands around his neck. I wasn't really choking him. Next thing I know, my hands are flying up in the air, and he karate chops me in the neck.
Now, this guy was an instructor?
Yes.
He was an instructor.
Yes, he was an instructor. He's a fellow Onondaga County employee.
And that's what he does all the time? He instructs in self-defense?
I never met him before. I mean, I don't know what he does, other than I was sent there, mandatory self-defense, did the thing, and now it's been a nightmare ever since.
So tell me this, when you think about the injury, do you think it was a serious injury?
At the time, didn't think it was that serious.
Like,
It hurt, but I
was
just
it
thought
really?
it was a karate chop.
It was a real bad karate chop?
The girl he hit before me, her name was, I forget her name. It was another girl, but when he hit her, she said in front of the whole class, "Don't fucking touch me." I'm sorry to use that word.
That's okay.
She used that word.
She used that word.
So yeah, it was a hard chop.
It was hard.
She was in her 20s. Apparently, she didn't get injured. When he did it to me, now I've got
You
constant neck pain. And
How old are you, sir?
I'm 39 years old.
So the injury happened when you were 38, right?
I guess that's right.
Before the injury, were you into any sports? Did you?
No. The only thing I did was I used to, do walking and fishing. That was it.
So, coming back to this psychologist, she wants you to go back.
They made another appointment for me in March,
And do you feel that you're not sure?
I don't know if it's going to help or not. I just know I'm in constant physical pain.
Now, let me ask you this second question. Have you tried to stop all the pain medications and see how you do without it? To see whether clear mind,
as far as cutting back,
right, whether you're not confused, whether you have a clear head.
I tried cutting back a little bit on the pain medication, and I'm going to end up in the emergency room. So, as far as cutting back, the pain is getting worse.
So Dr. Stewart felt that there was nothing neurologically, I see from his notes, correct?
That's what he says. But obviously there's something wrong, because you don't go from feeling fine, the constant neck pain, after a karate chop to the neck. There's a Dr. Chin here. He's up at University Hospital. Sent him my information. He says, I'd be more than happy to see you, but you got to have an MRI because your last MRI was over 6 months old. So I talked to Anthony Past. He said, well, you got to get a script for it, send it to me. Maybe you'll get approved, maybe not. And based on my last exam that was denied, I waited 6 months and paid for the damn thing. Whatever. I'm not going to wait anymore. I need answers, and I need a solution to my neck problem. Bottom line.
I
So,
see.
whatever.
You have high cholesterol and you have kidney problems, renal stones.
I've had a couple of kidney stones, yeah. They hurt like hell. I haven't had one recently, thank God.
Okay.
They just told me to drink more water.
Was the job really causing you a lot of stress?
No. That's not... job wasn't that stressful. Working for the county was probably the easiest job I've ever had. Except for the fact of getting injured, which I can't believe this is happening to me. I just don't understand why they can't just, if it's a disc, take it out. Fix it, operate. But I guess they want more tests done. And it takes forever. And nothing gets approved. Not your fault per se, but whatever. I'm in a lot of physical pain every day.
Have you always been on medication since the injury, or was there a period when you weren't taking any meds?
No. Since the injury,
Pain medication.
ever since I've been on the pain meds, they tomorrow. I mean, I don't know what they're gonna do. I can bear. I'm taking the max dosage. It's not managing the pain. I'm still in a lot of physical pain. I don't know if there's something else they can add. They can switch to something. I got another doctor here, Dr. Chin. He wants another MRI since the last one was 6 months. He wants to see if there's been any changes. That's going to take 6 months to approve. Whatever. I guess that's not what you're. I don't. That's not your problem.
Yeah, that's not my specialty. Is there anything else, Peter, I have forgot to ask you, which is important?
I just want this recorded, just because in case down the road someone says, "Geez, why didn't this guy just have this test?" Or "Why didn't he just? Why wasn't this done?" I can't remember everything. I can't remember things anymore. I take pain meds, so at this point, I just thought if I have a record of it, someone can look at it and say, well, what happened on that date? Well, that's what happened, and it's been 9 months. Still waiting, trying to get exams, trying to get treatment. I wish I probably would have had all these tests done if it wasn't workers' comp. For all doing, not your fault. But
so how much money have you spent on your own?
So far, $1,100 I spent.
Was that an MRI?
That was the CT exam that said nerve root blunting. And
all the others have been paid for by
comp. But every exam takes months. It's like doctor orders it today. If it was private insurance, I could have the exam this week. With comp, things take longer. And right now, I don't know what's wrong with my neck, but at this point, I've seen one orthopedic, one neurosurgeon since this whole 9 months continuing.
So
I want to find, maybe I need to go somewhere outside of Syracuse, maybe go to Johns Hopkins, go somewhere else. I don't care. I just, this Dr. Chin, he's another guy. He's supposed to know a lot. I asked him, I begged him, would you look at my information? Can you tell me what you think is wrong with my neck? And he said, well, you need to have another MRI. So I'm hoping maybe in the next couple of weeks I can have that done and see what, because to me, to go from no pain and everything was fine to a karate chop and constant neck pain, something's wrong. If you got karate chopped in your neck and you were in constant pain, I would think you would try and get results. You would go to doctors, and if I don't know. I'm sorry.
That's okay.
Whatever.
Thank you. Good luck to you.
I'm sorry.
Okay.
All right.
All the best.
Thank you, doctor. Bye-bye.
Good night.